Two main areas of surgery saw huge leaps forward during the war: brain surgery and plastic surgery. At the start of the war, there were very few surgeons or doctors with much experience in either of these areas. Removing shrapnel and bullets from the brain or face was very difficult to perform successfully, especially as this needed to be done as quickly as possible. Therefore, operations needed to be performed close to the fighting. Brain injuries could be difficult to diagnose. Patients might appear to have a very minor wound, but would actually have a serious, life-threatening injury to the brain. General anesthetics often made the brain swell, which made operating on the brain very risky and frequently caused further injury. As for all injuries on the Western Front, the risks of infection were extremely high. Soldiers who suffered a brain injury in the early years of the war were highly likely to die. However, improvements to X-ray machines and new methods of fighting infection helped brain injury victims, and ways of successfully treating brain injuries quickly developed. All head injuries, however minor, were examined as soon as possible. Doctors soon learned the signs of brain injury that was more serious than it initially appeared. Some casualty clearing stations were allocated specifically for brain injuries and doctors, and there were surgeons and nurses who specialized in this area. Surgeons soon changed to performing most brain surgery under local rather than general anesthetic, so the patient was conscious but could not feel the affected area. This reduced the risks of error and complications because the brain did not swell. Harvey Cushing, an American neurosurgeon, developed new brain surgery techniques while working on the Western Front and passed on his findings to other surgeons. He developed the use of magnets to successfully remove tiny metal fragments from the brain without causing damage. As medical care improved as the war continued, more men survived head injuries. However, many were left with horrific scars or parts of their faces missing. Some were unable to eat, drink, speak, or even breathe well. An ear, nose, and throat surgeon from New Zealand, Harold Gillies, became known as the father of plastic surgery, due to the methods and techniques he developed to repair and restore parts of the face. Facial reconstruction often required many operations and long-term care, which could not be done close to the fighting. Gillies persuaded the Army to set up a specialist ward for facial injuries at Cambridge Military Hospital in 1916. Then, as demand increased, in July 1917 he opened a specialist hospital with over 1,000 beds, Queen's Hospital, London.